Hi, everybody. On the Stigma-Free Society's Facebook Live event. Just waiting for people to log on 1 minute before as we embark on this journey for the next half hour on mental health and wellness. I'm Dr. Daniel Toe from the Surrey School District, and here to welcome you unofficially for the next minute as we listen to Stefan Kettenberg's Unreal. What you are, be what you are. And we are live. I think it's 2 o'clock now. We're about to get started. And I'm just waiting to see if people are logging on. And I'm waiting for Maddie or Andrea from Stigma-Free to give me the test or thumbs up that this is actually all working. Do I get a thumbs up, or I'll just keep going and hope for the best? Maybe we'll do that. Oh, there's somebody logged on. Is this working? Do you hear me loud and clear? Is my microphone clear? Hi, Maddie. All right. Well, we are now in our Facebook Live event. I'm assuming Maddie hears me, or is she telling me that it doesn't work? I want to thank you all for joining us on the Stigma-Free's Facebook Live event. I'm Dr. Daniel Toe from Surrey Schools, as I said earlier in the pre-intro of all of this. And today I just want to spend time. I've been away for a month. I took my summer vacation during the month of November and couldn't really go anywhere, but I did a lot of bonding with my family, with my wife. I think she's had enough of me now. I think she needed me to go back to work. But you know, we had a lot of time bonding, and even though we couldn't go anywhere where we typically would in November, we didn't really leave the house. We followed Dr. Bonnie Henry's and the provincial health sort of protocol of staying in our house and just local community, wearing masks in public places and all those good things. We did have a good time together and bonding together as a family. So that was good. It was a worthwhile November. I've come back rested and ready to tackle any educational issues that show up in our district, but also mental health and wellness issues. And always glad to be back with the Stigma-Free Society and broadcasting with them on behalf of the Surrey School District every other Tuesday. My preface is always that I do work for the Surrey School District. I'm the district principal in education services in Surrey Schools, and I run mental health and wellness programs. I also run summer programs and programs for at-risk and vulnerable youth. That is my portfolio. That is my work, and that is what I represent here with the Stigma-Free Society. But I'm so proud to be here. I'm glad that Andrea, the CEO, and Maddie, and all the folks at Lindsay who work for Stigma-Free have allowed me to keep coming on every 2 weeks. So thank you for that. So we do have a few questions that were presented by various folks that Maddie has sent to me earlier today. So I will tackle those 5 questions, most of them to do with COVID and mental health and education. But I just want to start off by my first hot take. But oh wait, before I give you the hot take of the day, I do want to share with you my personal information. We do have a new district website for mental health. If you go to Surrey Schools, www.surreyschools.ca/mental health, you'll get our new mental health webpage, and then you'll be able to check out all the different resources that we have with regards to mental health. It's still metamorphosizing into a complete page. We have almost everything on there, but we are going to add some additional resources, and it is continually changing as resources come up. We will continue to add them onto there. Of course, Stigma-Free Society's webpage and their youth toolkit and Stigma-Free toolkit and their youth COVID toolkit, all of that is on our site as well. So I just please take a look at our site and let us know what you think. Will hopefully provide more and more resources as the days and weeks and months progress. But that's my text, my cell phone number, my email, as well as the Twitter's on there. So if you want to text me during, or you want to send me an email to ask questions, I'm happy to take those questions. So on to the questions of the day. Before we do that, my take on the stress of today and the hope of tomorrow. Quite clearly, based on the questions that I have gotten over the last month or so, I've been sort of out of the picture on YouTube and on Facebook. I've sort of taken my month off and really did that across the board. I got some questions from parents about basically, and you'll see the questions. So the stress that the COVID-19 is placing on their families and on their kids and on their schooling. And as a parent of 5 and soon to be in a month, my Maddie turns 9. You know, it is a stressful time for families because we see that even kids. So my daughter, she turns 9 in a week. And unlike even her brother who turned 5 in June, we're not even really able to have, or not really, we're not able to have even her cousins over or her grandparents over because we want to follow the provincial health orders and we want to keep people safe and keep people healthy. With the COVID numbers the way they are in BC, even though they seem to have plateaued a little bit, but we can't be sure. We do want to do our part and keep people safe and keep the grandparents safe and cousins and everybody healthy. I think back to a story in the news where they had a small social function in a house of 6, just 6 people, and they got COVID from that because one of the folks brought it in because her bubble was bigger than the others, and that was just family. And so we want to be cautious and we want to be careful. But my daughter, being stressed out, she's stressed about not having a birthday, not even like her brother. She was happy with not having friends, happy with not having a bigger party like she typically would have because that's what I do for my daughter because I love her and I love my son. And but she was upset and sad about not even able to have her cousins over like her brother did and her grandparents over. And that's something that we've had to sort of work with her to work her through that stress of, you know, things are different. School is different. You're wearing a mask all the time in hallways, and even she has chosen to wear it in class, and my son has chosen to wear it in class. The way that you play with your friends are different. No, play days are different. Dance class is on Zoom temporarily. You know, all these things are different, and both our kids and the families, everyone's experiencing a great amount of stress. But I do want to put in the small plug for the hope of tomorrow. Yes, it is tough right now. Yes, it is stressful. I'm feeling it as a parent. I'm feeling it as an educator, that there is so much happening in our world today that's causing huge amounts of pressure both on our workspace and on our personal lives. But as there is hope for a vaccine to come, and we think that is imminent, and it's been said in even the public health officer, Dr. Bonnie Henry, and the folks across Canada, like Dr. Theresa Tam, have said that is imminent. A vaccine is imminent. It's coming to Canada. We don't know exactly when, but it is coming. You know, we think that there is time for us to have a bit of hope as the holidays come, as the Christmas season comes, or whatever holiday you celebrate, whether it's Hanukkah or you just recently celebrated Diwali, whatever you celebrate during this month of December, a lot of the celebrations are focused on hope. And I really want to put it out there that parents and kids and families and even educators, we need to have a hope of something happening in a month, 2 months, 3 months from now that will really change the face of all the stress and the anguish and the anxiety that we're facing today. I think if we live with hope and we live with looking towards that light, that as Dr. Bonnie Henry says, it's not forever, it's just for now. There is now a sense that the end of this pandemic could be on the horizon. It may take a while to get through it, but it is on the horizon. And I think if we live in that hope and we live in without the fear of the unknown now, that we are better able to tackle the stress and the anxiety that comes with the today. So the stress of today, the hope of tomorrow, let's look towards the hope of tomorrow as the fuel to help us deal with the stress of today. And that's my take on what's happening right now in our world educationally and with mental health. So now to the questions. I did get quite a few questions from parents or different folks in the system, and we have 5 of them, I believe, I hope, for you today. So let's deal with question 1 first. How do I think the cohorts are working in general, and are students able to follow protocol? Well, the cohorts are working, and in general, I think that I think I just spliced that question a bit, so the grammar is a bit off. But the cohorts, I think, are working quite well. When I look at my daughter's school and my son's school and all the different schools happening in our district, I think the cohorts themselves are are functioning the way that they were designed to function. We're trying to keep the bubble small. We're trying to keep everyone safe. And the kids really aren't really mixing with folks from other cohorts. I think that there's also the push to have kids really take on the responsibility of having masks and social distance in general spaces like hallways and such. And even though at lunch, I think outside at lunch and recess for elementary school kids, or when high school kids gather outside of class, I think that for sure we know, and I'm not making this up when I say that there's probably a mixing of kids and probably a mixing of cohorts, but we are outside. And I think if kids are wearing masks and keeping a safe social distance, sometimes that mixing of outside on the playground and in the general environment is okay. I think overall, in general, they are working. Are students able to follow protocol? I think the teachers are doing an amazing job at helping the kids follow the protocol in class, in hallways, in PE or gym, in the different educational environments like theater class and all the different type of classes that are in high school. I think the students are able to follow the protocol because the teachers have been excellent at promoting the protocol. I have teachers on my staff that are doing that, and when I visit the classrooms and look in from a social distance and just peeking through the door, I see that they are working with the kids to help them follow the protocol. And the kids are generally, of course I can't speak for every kid, but the kids are generally respectful of the protocol as well. And I think that's, I think things are working. I know some people are upset because there's a high level of exposure, or not high level, but many different notices of exposure that have gone off in various schools across the province. There are parents on Facebook tracking the notices, so this is nothing this is not new news that there are exposures almost every single day. But again, they're just exposures. According to our superintendent and according to the provincial health officer, there is statistically a low rate of transmission in schools. When I think back to my child's school and the different schools in Surrey that have gotten notices, there hasn't been a lot of transmission. There have been exposures, but not transmission. So I think that is helping also. We see that students are following protocol, and we see that there's not a high rate of transmission, still a low rate of transmission. So that, to me, shows that the protocols are being followed, because we know that when the protocols aren't being followed, when there's mass gatherings without social distance and mass happening in a mass gathering, that the virus spreads very quickly. And we've not seen that happening in schools, generally speaking. So again, to answer this question, cohorts I think are working, and students in general are able to follow the protocol, in my opinion. Question 2, do you think COVID-19 will have a long-lasting effect on our kids? Quite honestly, I think that the answer to that is yes. And I don't want to sugarcoat anything. I don't want to just let the elephant in the room just walk by, without me acknowledging. But I think COVID-19 will have a long-lasting effect on our kids. Right now, our kids have basically, from March till now, have had very or less social contact than they had even in February. They're no longer able to hug their friends. They're not able to really sit that close together. They're not able to have that social, physical interaction that they typically would have. Everyone's behind a mask. It's hard to read emotions behind a mask. It's hard to communicate behind a mask. And kids are resilient, and they've done it. And my daughter has done it, and my son has done it. The different students in my different classes have done it. The kids in our district have done it. But I think the long-lasting effect is threefold. I think, first of all, that kids will have to learn to communicate again. And again, really depends on the rate of how the vaccine or the cure or whatever comes out to crush and defeat COVID-19, whatever that looks like, it will take a while to implement. Even if it comes right away, January 1st, and we go through the different steps of who's getting vaccinated when, we will still need to social distance, wear a mask, control our gatherings until more of the population is vaccinated. So kids will know that there's a solution, but still have to engage in some of the protocol, which I think will be a different layer of stress for kids. I think that even once the folks are vaccinated, I don't honestly think life will become the same again, because COVID-19 might, much like the flu is going to still be out there. So will we still need to wear masks? Will we still need to social distance sometimes? Will we still need to, can we go back to what it was before we knew COVID-19 existed? I don't think we will. I'm happy to be proven wrong. I'm happy to be completely mistaken. But my opinion is that I think things will be different for a while. I think that we'll be able to gather shortly. I think we'll be able to have social interactions with our friends and with our family, but those things will come slowly. And I think that we will, as we opened up slowly throughout the summer, so too will we open up slowly when a vaccine eventually comes. And I think that's, that in itself will have a long-lasting effect. And even let's flash forward a year, 2 years from now, if we get back to relative normality, think maybe March, or think July, right? Relative normality, being with our friends, still wiping things down and wearing masks on occasion, but really everything is relatively normal. I think that will still have a long lasting, because kids will have to learn to communicate again. They have to learn to unlearn some of the restrictions they put on themselves to keep their grandparents and their parents and each other safe. And I think it's almost like a trauma, right? When you experience any sort of trauma, it lives with you for a while. And I think that this experience of COVID-19 for many families, regardless of race, ethnicity, social economic status, has been stressful and a trauma for everybody. And I think that's, that trauma will live with us as adults and live with our kids, and it's incumbent on us to help our kids and our loved ones get through that. Next question is, have you seen an increase in anxiety with kids right now, and how are kids managing their stress? Well, yes, I definitely have seen an increase with kids right now. I think we've spoken about that in previous iterations of this show, of Facebook Live for Stigma-Free, and also with our school district. We have seen an increase in anxiety with kids right now. I don't, this is a very stressful situation, from not like people like my daughter not being able to have her birthday the way that she wants it, to not being able to interact the same at school, to not having to as many activities as they otherwise would like, to not even being able to have a simple play day. And as parents, we encourage social interaction. We want our kids to have friends. We want them to get along with other people. But when they can't even be with other people, that is stressful for us and so stressful for them. There's also the additional added stress, with their kids, probably, and we had a couple Facebook Lives ago, we talked about kids worrying for their parents, right? Kids worried that their parents are worried about their jobs, about their finances, about their aging parents, about their friends, right? Kids are seeing the worry on their parents, and some of the kids, because they're wonderful kids, they're taking on some of the worries of their parents, and that also is raising anxiety. And I'm not sure if that's what we want for our kids. We don't want them to have to take on the worries of their families and their parents, but that also is heightening their anxiety. But how are kids managing the stress? They're using a lot of social media. I see one app that has been very popular amongst especially younger kids is Messenger Live for Kids. Parents also love it because they can control it and see it. But I've seen kids wanting to communicate on that, just even sending a simple hello to a group of friends. My daughter has a group that she works with in her school, in her grade for class, and she's grouped with them on the messenger. The parents can see the messages, she can see the messages, and it's become almost a release for them, these kids in this small sort of friend group, to be able to chat with each other and have virtual play days and things like that. And so kids are managing stress the way that they typically would at a young age, which is adapting to the situation and implementing the survival skills that they're allowed to use. We see that a lot with kids who have experienced childhood trauma. We're like, how did you get through that? You guys went through immense struggle as a family? How did you get through that? And kids are very, very adaptable. And that's why it's so important that as they get older, that we continue to deal with the trauma that some of the kids face, continue to deal with some of the stigmas that they feel from the way they've grown up. That's why we want to give them increased levels of membership and engagement opportunities that are different from traumatic experiences that they've had. Because kids, when they adapt when they're younger, will always look to, as they grow older, adapt to similar environments that they've been in unless they're given other opportunities. So that like the idea of membership, right? They feel membership with their family. Doesn't matter how that family is when they're younger. And then as they get older, they look for membership opportunities or opportunities to engage in things that were similar to their childhood. So, for example, kids who have been through possible abusive relationships when they're younger, unfortunately, when they get older, looking towards relationships, they tend to gravitate towards abusive relationships unless they know that there's something different, right? Kids who tend to have gone through poverty when they're younger, and their parents have taught them to save everything and save everything and make sure they have enough of everything, but save it and to be frugal, tend to be frugal as adults as well, even if they find that they have economic success later when they're adults. Kids who've learned to work hard when they're younger learn to work hard when they're older. Kids who grew up in gangs tend to want to join gangs unless they find other opportunities for membership. So kids manage the stress by being pliable and being adaptable at a young age. The key for us is to help them as they get through the stress, to realize that there is hope, that there is something different, there's something else to go to later on. And we've seen that anxiety, and kids are managing because they're adaptable, but it's our job as adults is to give them other tools to manage the stress, not just their ability to dive and navigate and shift between what's happening and what's reality for them, but to give them the proper tools to look towards the future, look towards hope, look towards different levels of engagement, and look towards how they can manage their stress in a more edifying way, so that they can, when this is all over, not have to live with that stress and live in that fear that they experienced just a year ago. And let's get, I'm 2:21. Get to the next question before I take any questions, if there are any. We recently received a note coming home that kids were not allowed to play around before school starts and must go directly to the Blue Star. I guess that's going home. Just as a comment on how very sad it is, and a question if teachers feel the students are getting enough physical activity. To be quite honest, the schools, the elementary schools I've seen, both in Surrey and the one that my children go to, do a lot. They really try to give the kids as much physical activity as possible. They do a lot of things in PE. They do experience. They do go outside unless it's like horrible weather. They are in their mud kitchen at my kids' school, and I know when I look outside our district building at the elementary schools, right, that's right outside of the window. There are kids outside as much as they can. So I think the teachers, again, are doing the best that they can to give the kids as much physical activity as possible. I think teachers, though, also hope that at home, the parents are also working with their kids to give them some physical activity opportunities, whether it's regular sort of extracurricular things, although that's been put out as a bit of a pause, depending on what sport the kids play. That's been a bit of a pause. And the weather is not as great right now as it was in the spring and summer, but I think the teachers, and actually I know the teachers, are encouraging their families to still go outside with their kids, to take walks with their kids, and do physical activities with their kids. And while teachers are giving physical activity opportunities, I think it's so important for us to do that as families as well. And the teachers are encouraging that. I think as families, we need to do our best to give our kids more physical activity time, whether it's inside the house, whether it's going for walks outside the house, whether it's bundling up and going for a bit of a cold weather bike ride, or getting up to the mountain if you have the ability to do that, or just going for a nightly walk with an umbrella and a big jacket. I think it's so important for us to continue that physical activity tradition. Even when COVID's all over, I think physical activity is such an important aspect of life, and of family life, and of existence, and physical existence, and healthy existence, and wellness. And I don't think teachers will ever think that the kids are getting enough at school, but they do their best to provide as much as possible. And the teachers are doing a great job at that right now. And I do have 8 more minutes to do the final question and to see if there's any questions online. I know there's not as many guests right now. I think we're, people are working and working hard at 2 o'clock. So hopefully people watching, if you have questions later and you're watching this, you can ask it in the comments or email me or text me or something, and I'll try and answer it at the next Facebook Live event. Finally, a lot of parents have concerns about Christmas break and not returning in January. Are there any things parents should be doing over Christmas break to prep for 2021? Quite honestly, I believe that school will continue, and Christmas break or winter break will happen at its natural point unless something drastically changes. We don't anticipate any change to the break time, at least in our school district, and I think that would be the same for all of BC. And is there a chance of not returning in January? Honestly, we don't know. I think a lot of things are predicated on the new provincial health restrictions that have happened in the last little while, and whether those have had an effect on the COVID numbers. For example, if the numbers come way, way, way down in the next 3 or 4 weeks, the results will be very different than if they go up to the thousands in the next few weeks, right? We also need to look at, the first week of Christmas break and the COVID numbers after that, and see what happens then, and see if there's going to be issues after even the first week of the winter break or Christmas break. Things that parents should be doing. First of all, I'm going to say, as a parent and as a teacher and as a principal, please take time to rest. Christmas break needs to be a time, especially now we can't have like a billion people over. We don't need to have piles and piles of gifts for people to come to our house and grab. We probably need to shop less, if not for presents, then for like Christmas dinner stuff. Please take time to rest. The parents, what you should be doing over the Christmas break is spending quality time with your family and really building up that family unity to endure for the last remaining leg of this race called the COVID-19 pandemic. So that's the very first thing. I encourage every parent or every step parent, every guardian, every grandparent who's watching children, whoever you are out there, being with your small family, in your only family unit, spend time with each other and just love each other, and don't worry about schoolwork or doing extra math or English or anything like that during the beginnings of the Christmas break. Second of all, I think that it's important to take as much you can home. We don't know if, again, I think that we will all come back at the proper time. Christmas break will happen at the proper time. 2 weeks later, Christmas break will end, and we'll all come back to school. So, I think that the schedule won't change. I think there's been a real push to have school continue because kids need it. They need that level of socialization, especially when we're not getting it really anywhere else. They need that community, their school community, and the schools have been doing an awesome job at keeping them together. But over Christmas break, I think it's important to take as much as you can home. I think taking home whatever binders, whatever schoolwork that's hidden in a desk somewhere is important to in case something happens where we do have to shift back to online, because that is entirely possible. I doubt it, but it is possible. I think to be prepared at all times to switch at the drop of a hat if something changes. If there's also the cases like, we in Surrey, we have had 2 schools that have had outbreaks, and we've had to switch to an online platform for those schools because everyone's had to self-isolate. So just like we tell people all the time during this COVID-19 pandemic, take your laptops home for teachers, take your schoolwork home, just in case you have to be at home, or just in case someone gets ill, whether it's COVID or just the flu or whatever. You want to be prepared to be able to stay at home for a small period of time, and to be able to keep engaging in the schoolwork. Make sure you have your teachers' email addresses so you can communicate with them, and make sure you're on the school's web send out, sort of web, the school's mailing list. Oh, I lost the word because it's all internet. The school's mailing list. Make sure you're on the school's mailing list, because if you're on the school's mailing list, then you'll get the most up-to-date information. I know also our superintendent, Dr. Jordan Tinney, does produce videos for our school district families, but they're on Twitter, they're on Vimeo, and he produces some really great information that is not just for Surrey kids, but it talks a lot about the provincial direction as well, because all of us follow the direction of the provincial health officer and the Ministry of Education. So I would be prepared with information. I would be prepared to have things at home, and I also be prepared to make sure you stay connected to your child's school. Those are the three things I think you need to be ready as we head into this break. All right, so I'm on my last minute. There is a question: does the Stigma-Free Society's student mental health toolkit have activity suggestions? I think there are activities in there. I haven't looked at it in the last couple of weeks. Maybe Maddie or Andrea could answer that question that's on there. I believe there are activity suggestions. I believe there are things that you can do with your families that are in the Stigma-Free Society student mental health toolkit and the COVID toolkit, and they're always also building things. So if they don't have it, I hope that Maddie and Andrea, you take that as a suggestion for what can be in there. But I believe the last time I looked, there were activity suggestions and dialogue suggestions for families. So again, with that, my 30 minutes is done on the Stigma-Free Facebook Live. Again, here is my information, and feel free to text or Twitter or email me at any time. Resources are going to be at surreyschools.ca/mental health. And once again, thank you for listening. Thank you for watching. I know many of you watch afterwards, so love to see your comments and hear from you. Thank you so much for your time, and I'll play you out to the same song that played you into. Have a great time. Don't just survive, thrive out there. See you later, everybody. Cheers. Have a great day.